Hi, my name is Syed Noman Shah with the student ID S8116654, and today I'll be presenting how digital health can improve emergency care for rural trauma patients, focusing on the scenario of a person named John, 42-year-old farmer, who sustained a suspected intracranial injury. This presentation will discuss John's health challenges, risks, needs, and how digital health, especially the allied care platforms, can enhance this emergency management. John is a 42-year-old man living in rural Australia. After a farm accident, he presented with the symptoms indicating a possible intracranial injury. A major issue in John's situation was distance. Specialist support and diagnostic service, which were 250 kilometers away. It places him at a high risk for deterioration during transport. Research shows that delayed neurological assessments increase the risk of severe outcomes, especially in trauma patients, and also when bleeding or swelling is suspected. This makes early digital consultations very necessary. John is experiencing several interconnected challenges. First is physical, which is at risk of intracranial bleed, shock, hypotension, and rapid deterioration. Second, regarding his mental deterioration, trauma and isolation, which contributes to fear, confusion, and heightened anxiety. Socially, he is affected by a rural healthcare inequality. Long distance and limited local services lead to delayed diagnosis and treatment, which is a recognized issue for rural communities in Australia. Together, all these factors place John in a highly vulnerable situation. In terms in health needs and preferences, John clinical needs includes immediate neurological assessment, rapid interpretation of imaging, time critical decisions about whether he requires transfers or not, ongoing communications and reassurance, support for his family and himself during this hard time. In terms of preferences, John wants care as close as possible to his home and transport when necessary. This is consistent with research showing rural patients value local care and minimal disruption. Digital health helps honor these preferences while still ensuring safety. In terms of potential risks, without rapid digital intervention, John faces several major risks. The first one is missing an intracranial blade. Secondary is the brain injury due to delay, and the after one is long-term disability, increased mortality, significant emotional distress for both John and his family, and a high-risk cost related to late diagnosis. Digital solution reduces many of these risks by just enabling earlier assessments. In terms of digital health strategy, the chosen digital health strategy in this scenario is Alaya Care, a cloud-based digital platform used widely for virtual care and remote monitoring. The key functions that includes in this Alaya Care is real-time documentation, secure messaging between rural nurses and specialists, mobile access to clinical updates, telehealth with both video and audio functions, and remote vital sign monitorings. These capabilities make Allied Care very well suited to time-critical trauma assessment in rural settings. In terms of supporting John, using Allied Care, the rural team can immediately share John's neurological observations with the metropolitan neurological teams. Video telehealth allows a specialist to visually access John, review his vitals and neuro status, and guide treatment decisions accordingly. This will ensure a faster decision making, early escalation if John deteriorates, reduced diagnostic delays, safer and cleaner and accurate handover and documentations, and more coordinated transferring while during planning if necessary. Overall, digital health bridges the gap between rural and metropolitan services. Now, there are few challenges that can be faced during using this digital health platform. The first and the major one is the poor digital connectivity issues, which is very common in rural Australia, which can lead to dropped video calls, delayed transmission of imaging and findings, lack of reliable hardware. The nurses can really assess in this situation by test the equipments and hardware and softwares early, have backup telehealth platforms, switch to audio if the video call fails, and documentations of all necessary limitations clearly. Proactive preparations reduce the impact of connectivity issues. The second challenge that can be faced during using digital health platform could be staff training and confidence. Many rural nurses may not be fully confident using telehealth technology during high pressure trauma events especially. The challenges they could face is limited training, lack of simulation and practice, stress management and time pressures. The nurses could really help them out with regular simulation training, step-by-step telehealth setup checklist, clearer communication protocol with the specialist teams. Building staff confidence ensures smoother and faster digital assessments. Another challenge will be clinical risk management. Clinical risk increases when digital tools replace or delay hand-on assessments. Researchers highlight the risk of over-reliance on telehealth. The nurse could action this by allowing follow the ABCDE trauma framework, escalate immediately if the deterioration occurs, use digital assessment as an adjunct, not a replacement for a physical assessment, and prioritize transfer when telehealth raises concern. This protects patient safety while still using digital tool effectively. Families sometimes feel digital care is not real care, especially in emergencies. Common concern they have raised is no specialist physical presence, confusion about how telehealth works, and fears about misdiagnosis. The nurses could help them out with explaining benefits and safety of telehealth, reassure the family and the patient that specialists are directly involved, provide the frequent updates, and use simple languages to explain the clinical decisions making. This improves trust, reduce fear, and increase engagement. Nurses plays a vital role in ensuring safe and digital effective trauma care. According to NMBA updated telehealth guidance, the key strategies would include trauma-informed communications, testing and preparing telehealth equipment, accurate documentation, early coordination with retrieval teams, clear and structured handover, continued assessments and monitoring of John in this scenario. Nurses ensures digital tools enhance, not compromise patient care. Social media can increase awareness about the benefit of digital trauma care. However, the Australian Health Practitioner Regulation Agency requires strict protection of privacy. Safe action include sharing de-identified case examples, discussing improvement in rural health outcomes, never share images, name or identified details. This support education while maintaining confidentiality. Social media can also be used to, for example, in case of consumers, it provides information on telehealth benefits, explain when virtual care can be used in emergencies. In terms of patient education, we can share videos about recognizing head injury symptoms, teach rural families how virtual emergency pathway works, and in for professional practices, it does shares de-identify cases, promote success stories for rural tele-trauma program. This helps strengthen community understanding and clinical learning. These are the references using throughout the presentation following APA 7th edition. These include peer-reviewed journals, government reports, and reputable digital health sources. Thank you for listening.